These clinical cases of exceptional rarity bear witness to biological complexity and human resilience in the face of orphan pathologies. By exploring these singular destinies, we analyze the frontiers of modern medicine and the vital force that drives us. Number 10. Lai Singh, craniofacial duplication, diprosopus. The case of Lai Singh, documented in India in 2008, represents an extremely rare clinical manifestation of craniofacial duplication, known scientifically as diprosopus. This major congenital anomaly results from a complex disruption during embryogenesis, generally involving abnormal activity of the SHH protein, which regulates the width of facial structures. Unlike conjoined twins, this phenomenon is characterized by a single body and limbs, but with a partial or total duplication of cephalic structures. In this specific case, the child possessed two functional faces on a single skull, maintaining surprising biological autonomy, particularly in feeding functions and eye coordination. The socio-cultural aspect played a predominant role here, as the community perceived this singularity as a divine manifestation. From a medical perspective, managing such a condition requires rigorous multidisciplinary neurological and structural monitoring to evaluate the long-term viability of shared brain functions. Number 9. Sophia Weaver, unique combination of severe conditions. Sophia Weaver embodied an unprecedented diagnostic and therapeutic challenge, illustrating the category of ultra-rare patients. Her condition combines severe facial and structural dysmorphisms with complex neurological and metabolic pathologies, notably Rett syndrome and type 1 diabetes. This convergence of disparate pathologies necessitated holistic and coordinated management, involving dozens of surgical interventions and near-permanent hospital surveillance. Rett syndrome, in particular, imposed severe limits on her communication and motor skills, making every interaction precious to those around her. Her medical journey highlights the vital importance of pediatric palliative care and support for families facing constant prognostic uncertainty. By becoming a leading figure for the defense of medically complex children, she helped raise public and institutional awareness regarding the need for an inclusive and highly specialized care infrastructure for these unique cases. Number 8. Isosomercha, bilateral macrostomia. Bilateral macrostomia, of which isosomercha is one of the rare contemporary examples, is a congenital malformation resulting from a failure of fusion between the maxillary and mandibular processes during the 7th week of fetal development. This condition, which results in a cleft extending from the corners of the mouth toward the ears, creates the appearance of a permanent and widened smile. Although this anomaly can lead to initial difficulties with breastfeeding and speech, it does not necessarily compromise cognitive development or overall systemic health. Isa's case benefited from global media visibility, transforming a striking anatomical difference into a message of positivity and acceptance of body diversity. Surgically, the correction of macrostomia aims to restore the function of the orbicularis oris muscle and improve facial aesthetics. This case serves as a reminder that, despite the statistical rarity of the pathology, targeted plastic intervention and solid family support can ensure an optimal quality of life and harmonious social integration. Number 7. Baby boy in Bangladesh, progeria syndrome. The appearance of progeria syndrome in a newborn in Bangladesh in 2016 offers a striking perspective on the genetic disruptions of cellular aging. Hutchinson-Gilford syndrome is caused by a sporadic mutation of the LMNA gene, leading to the production of a truncated protein called progerin. This accumulation of progerin causes nuclear instability and premature tissue senescence, giving the infant the physical characteristics of an 80-year-old man from the first days of life. Manifestations include thin skin, loss of subcutaneous fat, and early cardiovascular risks normally observed in the elderly. Despite the severity of the diagnosis and the limited life expectancy associated with this condition, The welcoming and optimistic reception from the family moved international observers. This case emphasizes the need to pursue gene therapy research to curb the devastating effects of this mutation while managing systemic complications through a geriatric approach adapted to pediatrics, a major medical paradox of our time. Number 6. Jackson Buell, microhydranencephaly. Jackson Buell defied all medical statistics by surviving more than 5 years with microhydranencephaly, an extremely severe structural brain malformation. This condition is characterized by the absence of a large part of the cerebral cortex, replaced by cerebrospinal fluid, as well as a malformation of the cranial vault. While the initial prognosis predicted a survival limited to a few hours or days, Jackson demonstrated remarkable organic resilience, managing to interact rudimentarily with his environment. His case fueled important scientific debates on neuroplasticity and the functional role of the brainstem in human consciousness. His exceptional longevity allowed neurologists to study biological compensation mechanisms in severely atrophied brains. The devotion of his parents transformed his existence into an advocacy for the dignity of people living with profound neurological disabilities, proving that the value of life cannot be measured solely by conventional clinical criteria or pre-established survival statistics. Number 5. Vanellope Hope Wilkins, Ectopia cordis. The case of Vanellope Hope Wilkins, born in 2017 in the United Kingdom, constitutes a historical milestone in the treatment of ectopia cordis, a malformation where the heart develops outside the chest cavity. This pathology, often associated with other abdominal wall anomalies, presents an extremely high mortality rate from birth. Her survival was made possible by a multidisciplinary surgical intervention of rare complexity, involving 50 healthcare professionals. The surgical strategy consisted of progressively creating enough space in the thorax to reintegrate the heart and reconstructing artificial bone and skin protection. This medical success testifies to technological advances in neonatology and pediatric cardiac surgery, allowing a diagnosis once considered fatal to be transformed into a chance at life. Vanellope's journey illustrates the determination of medical teams to push the limits of interventionism to correct major structural defects, thus offering concrete hope for future documented cases of ectopia cordis worldwide. Number 4. Novojoyhunia, unclassified multiple craniofacial deficiencies. Novojoyhunia represents the complexity of unclassified dysmorphic syndromes, where multiple structural anomalies coexist without a precise genetic diagnosis being initially established. Born with jaw malformations, severe cleft lip and palate, and an absence of ear canals, her care required immediate and permanent respiratory and nutritional assistance. The absence of a name for her condition places families and doctors in a zone of therapeutic uncertainty, where every treatment must be personalized according to the child's evolving needs. Her journey highlights the resilience needed to navigate a healthcare system in the face of the unknown, where motor and cognitive progress is slow but significant. This case also underlines the crucial importance of continuous genomic research to identify new pathogenic variants. The patience and unconditional love of her family allowed a heavy medical reality to be transformed into a series of small, daily victories, illustrating the strength of the human spirit in the face of the most mysterious biological adversity. Number 3. Pranshu, mysterious condition. Worshipped as a god in the Punjab region, the case of young Pranshu illustrates the fascinating intersection between an undiagnosed congenital pathology and powerful secular cultural beliefs. Presenting atypical facial features, notably a prominent forehead and severe mobility limitations, this child was integrated by his community into a sacred spiritual framework, radically altering his social trajectory. On a purely clinical level, his traits suggest a complex form of skeletal dysplasia, or a rare genetic syndrome affecting bone growth, though the absence of a formal diagnosis leaves a lingering mystery. This unique situation highlights how the perception of physical difference can vary considerably depending on the sociocultural context, transforming a potential disability into a symbol of blessing and collective hope. For healthcare professionals, this case raises fundamental questions about access to diagnostic care in rural areas and the importance of respecting cultural structures during medical interventions. Pranshu remains a striking example of how a biological anomaly can be positively reinterpreted by a society, offering the child a protective status. His story prompts reflection on normality and the place of different individuals in our global social structures. It shows that dignity can be born where science does not yet have a name. Number 2, Grayson Cole-Smith. Grayson syndrome, 22 congenital malformations. Grayson Cole-Smith has been the subject of unprecedented international medical attention due to the presence of 22 distinct congenital malformations, a constellation of defects so unique that it led to the designation Grayson syndrome. His clinical picture included serious multi-systemic involvements, including cardiac and neurological anomalies, and structural malformations of the axial skeleton of extreme complexity. Despite pessimistic survival predictions limited to a few days, he benefited from more than 30 major surgical interventions, demonstrating the effectiveness of long-term pediatric intensive care. His unexpected capacity to acquire sensory and verbal skills testifies to an exceptional organic resilience in the face of a pathological load that should have been fatal. This case highlights the need for high-precision care coordination and constant innovation in pediatric reconstruction techniques. Grayson's death in 2021 closed a life marked by exemplary strength of character, offering researchers new perspectives on the limits of multisystemic survival. His family transformed his story into a global message of tolerance and a fight against cyberbullying related to physical appearance. Grayson will remain in medical history as the child who defied all statistics through his simple will to live. Number 1, Eli Thompson. Congenital arhinia. Congenital arhinia, from which Eli Thompson suffered, is an embryological development anomaly of absolute statistical rarity, resulting in the total absence of external nasal structure and internal olfactory cavities. This condition, affecting approximately 1 in 200 million births, imposes immediate respiratory and nutritional challenges from birth, requiring emergency procedures such as a tracheotomy. Beyond the obvious physical constraints, Eli's clinical management involved long-term surgical planning aimed at aesthetic and functional facial reconstruction, while closely monitoring his cranial development. This case helped sensitize the global medical community to isolated facial malformations and the crucial importance of psychological support for parents facing their child's physical atypia. Although his life was tragically short, his passing left an indelible mark in the annals of neonatology, illustrating the extreme fragility of life when basic anatomical structures are missing. Eli Thompson remains an essential clinical reference for the study of mid-face development, emphasizing the importance of highly specialized care. His legacy is one of pure beauty that needed no conventional features to touch the hearts of millions of people around the world. Number 11. Moment of the unexpected case. In a Belgrade hospital, a newborn rests against his mother, surrounded by an attentive team. His case, reported without sensationalism, follows a traditional medical protocol. Here, beyond diagnostics, every gesture carries a promise. In the silence of the corridors, science meets compassion, and a fragile future begins to be written. These extraordinary stories highlight the fragility, complexity, and remarkable strength inherent in human life when faced with the rarest medical circumstances. These clinical journeys, combining surgical prowess and individual courage, continually redefine our academic limits. Beyond the diagnoses, they remind us of the paramount importance of ethics and innovation in managing the most exceptional pathologies of our time.